Hi everyone. Hello, just waiting a few moments. And then we're going to be starting this 6 p.m. talk. I just want to make sure that people have a bit of time to come in. And most importantly, if people can hear us. At least if people can hear me as a start. So if you can't hear me, then I'll get closer.
There's one person.
Okay. So, all right. So, for today's talk, having gone through the polls, just before I talk about the polls, I would first like to say that today we're in this beautiful resort called the Desaseni Eco-Friendly Resort. It's and inside an art gallery which they're having at the moment. It's a wonderful place to come and stay here in Bali for many different reasons. And I would also like to thank the Desaseni for allowing us to do this talk here today. And also hosted by Teko Teas, which is just this wonderful tea just behind us. Indonesian tea, highly, well, it's worth a try.
Highly
worth
exquisite.
A taste. Highly exquisite, thank you. Exactly. And I would also like to present, more importantly, our guest today, Natalia, who's a certified art therapist and who's going to be joining me and us all to get today in this conversation. So as I was saying earlier, I did a poll just to see two topics and they came quite close to each other. Today we're going to be talking about the stigma of mental health, but I thought I would just keep the other topic because you also showed interest for the other topic on the traumas of can we recover from the trauma of relationship for the next talk, so that will be happening next week. So there won't be a poll for next week, we're just going to go directly into this subject. So for today, with Natalia as our guest, we'll start talking about this stigma of mental health and what it is. So perhaps Natalia would like to say a few things, like maybe getting started on what is the stigma of mental health, and we'll just have this kind of very easy conversation. If for whatever reason you don't hear us, just please comment and then we'll get closer.
Okay, so good afternoon everyone, wherever you are in the world, morning, afternoon, wherever that is. Thank you so much for coming and joining us. So when Jeremy reached out a couple of days ago and said, hey, what should we discuss? And there was these two options. I just said, well, I think that right now the stigma of mental health is, is really a present and meaty topic that should be brought up. Because with this pandemic and everything that's been going on around the world, it seems like there is and there was a stigma, and there has always been a stigma of mental health. And I have a feeling that even more so here in Asia than in other countries and in other continents. And I was thinking that, many of the people that had this stigma of mental health and that kind of wanted to put all that uncomfortableness in the back of their head are now being like pushed to the wall, and something inside of them is telling them you have to deal with this now. I think that the most important thing for us is like, where do we think culturally the stigma of mental health comes from? And for us as professionals, how do we collaborate to that stigma being still present, or how do we collaborate to kind of erase it?
Yes, it's very, very true that we're going through very difficult times now, very challenging times. And so people have they don't know what to do actually, for many of them.
Yeah.
But something I'd like to say something about the stigma, because I'm not sure if, just to clarify for some of our listeners, the stigma of mental health, or what is a stigma? The word stigma really is about how we see someone in a negative way.
Yeah, it has a very negative connotation. I think that's something we can definitely agree on.
And so this negative connotation might be because of various reasons, which can be because of their education, or their perhaps a culture. If this is something that's acceptable,
right,
or not acceptable.
And I think that like that actually that cultural part here in Asia is huge. I don't see it so much in Indonesia as I saw it before in Vietnam. When I was practicing as an art therapist in Vietnam, I came across a wall to find that the word, you know, what I was doing, mental health, like the word didn't even exist in Vietnamese. Because there was this expression that was called losing face. And if you have a problem and if you need help to deal with it, and if you can't fix it on your own, then it's a lose of face. And that is, I find it common amongst various different cultures across this continent. So that really, you know, working with local clients really made it difficult, not only because of the language barrier, but because it just doesn't exist. Like the concept of mental health doesn't exist, and how do you address something that doesn't exist in a culture?
Yes.
And that was very interesting. Like it was a massive wall. I worked a lot with the expat population, but it turns out that the local population needed a lot of this work, not only because of the war that had passed a couple of decades ago, but also because we all need mental health at some point or another in our life, because life happens to all of us, and you know, life can get pretty shitty sometimes, and it is what it is.
Yes, yes, and that's important actually, because the issue perhaps with mental health, unlike other maybe medical conditions, is not something that's clearly visible.
Right, it's not so tangible.
It's not always tangible. I mean, we present with certain symptoms, but we might not necessarily understand what it actually means.
Right.
And these might be changes in our behavior. We might present with, you know, symptoms that that other people won't really understand because they're more hidden.
Right.
You know, whether it's maybe an eating-related disorder, you know, it might be something that's hidden, or maybe it's, I don't want to appear weak in front of my friends, so I'm not going to talk about my worries and what I'm sensing. So it's all kind of hidden, and it's not really manifested like maybe a broken arm, or if I'm suffering from diabetes.
Yes and no, because then you get clients that start to get these medical problems that, you know, that start to come up, and they're like, well, you know, I just have this pain in my stomach, or I'm really constipated, or, you know, I'm just, or in the other way around, I can't stop myself from going to the bathroom. And you know, I always tell my clients, like, we hold our emotions here. This is why the Greeks thought that we had the belly, our heart in our belly, because this is where we feel everything. And of course, all of that, you know, when we don't pay attention to what's going on emotionally, well, then our physical body is like, dude, you're not going to pay attention, I'm going to show you.
Oh, yeah.
And then all of these, like, symptoms come up physically because we're not willing to pay attention to them mentally. And also sometimes, you know, I find it tricky for people when they come to the office and they're like, oh, well, I've been waiting so long, you know, to come here, but I didn't know if it was going to pass. So, you know, people that go into a depression, and they're like, well, you know, it's been like over a year. And I'm like, do you think it's normal to be so sad and feeling without energy for over a year? And, you know, it's also that part of the lack of, you know, of knowledge of what is okay and what is not okay. And one of the things, like, is it really impairing with your life? Is it, you know, if you're sad because a person that's close to you passed away, well, of course you're going to be sad, you know, and that will get over with. But, you know, if you've had no apparent, like, motive to be really depressed about something, that you just don't find the energy to get out of bed, and everything is just without joy. And, you know, then you're like, well, you know, then maybe there is something else going on.
You touched on an important point that I'd like to highlight, is that of perhaps a lack of information or a lack of education, and how easy it is without proper information to be misled.
Yeah.
And to maybe not be okay with just recognizing that my symptoms are real, and I can reach out for help and do something about it.
Right. Yeah.
So yeah, it's how to be informed. How can we, I mean, in terms of like the stigma around mental health and all the taboos around it, and perhaps how mental health is being portrayed in the media or in movies, perhaps in a kind of a negative light sometimes.
For sure, for sure.
You know, so it
yeah.
kind of puts more barriers, you know, in fueling this.
And you know, the other day, I mean, it's not only the media, it's not only the movies. I think that we also play a very important part in it as therapists, and I think that it's also the you know this like culture where everything now is showed through a screen, and we only want to show the good stuff, and we're not we're not willing to look at all, you know, the gooey, yucky, and you know, just not so nice stuff that happens underneath that perfect surface that we post on Instagram or on Facebook or any of the other platforms that are now, you know, popular. And I think that that's also helped. Like, this is Bali. I was thinking about, I went to a yoga class this morning, and everybody had that stupid shirt that says good vibes only, and I hate that shirt because we're not, you know, it's not good vibes only. We're also allowed to have bad vibes, and we're also allowed to get angry, and we're also allowed not to like everything or anyone. And this is something that I really try to work with my patients, because, you know, the good vibes only, why do we always have to be okay? No, I think that the first part of like ripping off that stigma of mental health is explaining to people that, you know, that it's really okay not to be okay, and that is valid, and then this is where we grow, when we fall down and when we learn, and those are our opportunities.
Very, very true. I think that's the most important message, is that it's okay not to be okay.
Yeah.
And that's really the first step towards understanding your emotions, to learning about your emotions, to learn how to regulate them, and perhaps redefining this idea of perfection.
Exactly. And also, it's not only about, you know, learning to regulate them, but learning to, you know, to understand, okay, this in me, this is what anger feels like, and I am furious at this moment. So how am I going to express this in a way that it doesn't take me to, you know, just get in my scooter and kill somebody with it? No, you know, how can I express my emotions safely? How can I communicate my emotions in a way that is not going to hurt other people, but I'm also going to be taking care of myself? And I'm going to be communicating, well, Jeremy, you know what? I'm pissed off at you because you were late, or you took me for granted, or blah, blah, blah. And I'm going to be communicating this with you, and you might, you know, get hurt. But I am telling you, this is how I feel, and I'm being responsible for my feelings.
Yes, that's really important. To know that it's safe to be able to communicate what you feel, as opposed just to keeping it for yourself. And maybe that's what you've learned. That's how you've learned to be, because of your family background.
And that is, you know, what were we taught as kids? You know, what did they tell you as a boy in, you know, when you were growing up? What did, you know, if you were crying, what did mom or dad say?
Like, boys perhaps don't cry.
Yeah.
And you know, just, you know, be a boy, and you have to be strong.
Macho. Yeah, you have to be strong.
Exactly.
Or you know, I got, you know, questioned with my son. Why are you crying for this? There's no reason to get upset. You know, there is nothing more castrating and more invalidating as a parent than to question your kid's feelings. Because then you know, what are you communicating to them at the end of the day? It's not okay to cry. It's not okay to be upset. And, you know, these are not emotions that we should show. So, you know, then we're dealing with a bunch of adults nowadays that are perhaps quite inept at communicating their feelings, and we wonder why. And it's also that cultural, like, background that we grew up in. So it's, you know, it is as it is. And unfortunately, I think nowadays there's more awareness of these things, and these things are being spoken out more and more, and these things, you know, can be talked about, and it's okay to hate. And it's a very strong word that people, you know, are terrified of it.
Yes.
They're terrified of it. Yes. But we love and hate at the same time.
Yes.
And that's valid, and that's okay.
And that's okay. It's okay to experience pleasant but also unpleasant emotions, and to identify them
Yes.
and to communicate them.
Yeah.
And it's not a bad thing or a wrong thing to communicate
Yeah.
those emotions.
And we're allowed to feel frustrated. So I was talking to a friend when this whole pandemic thing started, and she was in the Netherlands. She has 3 boys, teenagers, and she is living with her partner who has another 4 boys. So she lives with 7 boys, teenage boys, in her house, only woman, and they were all locked up in the Netherlands for a couple of months. And I spoke to her, she's like, hey, so how are you doing? How are you holding up? And she said, I want to get into the car, I want to drive my 3 kids to the wood, tie them up to a tree, and then come back and take them for a weekend. And I said, you know what? I completely understand. I would want to do the same. Will we ever get around to do it? No, but there was a genuine desire to just get, somebody else deal with these kids. I want to kill them right now. And being able to acknowledge that and being able to have that is just really healthy, and it's really important. And I think that that's part of ripping off that stigma of mental health. Being able to deal with the yucky and the ugly and looking at it DI and saying you're also part of me.
Yes. But it's okay to be able to not be okay. I think that's a key element to say again and again. I think really for.
So I had a question for you. The other day, every time a new client comes into my session, and because we live in such a small island and you run into everyone all the time, I find it tough sometimes.
Yeah.
It's challenging to keep boundaries as a professional. It's even tougher in an island of Bali when you're in your bikini and you run into your clients and you're like, ooh, this is strange. And you just kind of have to brush it through. But I always tell my clients, for privacy purposes, you know what? If I encounter you in the street, I'm never going to address you first, because I don't know who you are with, and I don't know if you want this person to know that you're coming to therapy or not. And I just want to protect your privacy. And if you come and address me, I'm super happy to say hello, but I'm not going to come up because it's just as a way to protect you. But the responses that I've gotten from 2 clients is, but why? There's nothing wrong with coming to therapy. I said, of course, there isn't anything wrong with coming to therapy, but by putting up, these defenses, it's not defenses, it's like boundaries. I don't know, I'm curious about how you manage those, because I don't want my clients to feel that I feel there's something wrong with them coming to therapy, the other way around. But it's that fine line. How do I manage that boundary, and how do I manage that there's nothing wrong with what you're doing, I'm just protecting you?
I mean, we have an important role in the way that we make our clients feel, and establishing these boundaries of being able to talk about something that can happen, not only in Bali, but maybe in other places, depending on where you are. And the smaller the place, and the more likely you might bump into your clients. But it's not to put them off. It's more of just to make them feel comfortable, and more like as a sign of respect that I won't approach you unless you do. It's up to you. It's okay. It's fine. Simply because out of respect to some people, maybe they still didn't pass that hurdle of perhaps maybe fear around it, maybe ideas of shame around it. So it's like you're acknowledging these feelings, these possibilities, telling them that it's okay to have all these feelings, but at the same time, if you were to see me outdoors, you can feel comfortable to know that I won't approach you unless you want to, and it's totally okay either way.
Right.
But I think talking about it in this open way, without creating kind of turning it into something that is maybe a pressure or a negative connotation or an uncomfortable situation. You're kind of breaking the ice while putting certain boundaries. As your therapist, we have a contained space for that. So just out of respect of the space that we have, for the sake of the process, it would be better that we just we preserve
that space,
the sanctity of this healing space that's so important, as to hold space for the person who's seeing you, and out of respect for that. So it's not out of stigma, or not out of kind of reinforcing the stigma around it, but just putting boundaries and explaining what
Right,
it is,
what's going on.
what's going on, and yes, like you say, I mean, you might bump into them on the beach, you know, you might bump into them in a restaurant, you might bump into them in a nightclub,
Yeah,
you know,
or the supermarket,
because you know, as psychologists have lives, you know,
Yes. We eat and sleep and drink.
and it's okay to have the life and to show that this is an example of you know, of being human.
Yeah, I think
You know,
it's a
and that's important part actually in terms of stigma around mental health, is that people who are in mental health, professionals like us in mental health, where we're here, we're here to understand the people who are suffering. You know, we're human beings, and there's nothing to be afraid of. That in terms of, like, we're not here to be judging you. We're here to be helping you and understanding you, and we're human just like you, with our perfections and imperfections, and mental health is being human.
Yeah, it is.
It's yeah.
It definitely is. Now, another thing that I find curious, or that maybe sometimes might affect the stigma of the mental health, is everybody seems to be terrified of the referral to a psychiatrist. And everybody seems to be terrified to be diagnosed, or to be, you know, or to have,
Labeled.
to take, labeled, or to take medicine. So it's, as a professional art therapist, I cannot diagnose, I cannot prescribe, I cannot, but, you know, I have my fair enough, you know, share and knowledge of the mental, let's say, I call them mental disorders. I'm not, you know, let's
Mental
just say
illnesses.
that's the mental illnesses, and I do see them sometimes pop up in people, and I also know my limitations. So I know that there are some times where, you know, this person also needs additional help to what I am providing. So when I refer them sometimes to a psychiatrist, they're like, no. Like, okay, no, what is, and it's like, you know, it's fine. They're not necessarily going to medicate you. They're not necessarily, you know, you're not going into a psychiatric hospital. And actually what you have, probably around 60% of the population of the world has it. So there's nothing to be afraid about. But there's this fear against, you know, medication labeling, and, you know, all the, you know, all the psychiatric aspect of it.
Yes, it's very true. Obviously, there's a history behind that.
For sure.
Of course, the field of psychology, mental health, comes from a background in history that's been, you know, thwarted with a lot of, you know, mistreatments.
Yes.
When we look back, you know,
Yes.
and so this idea of being crazy, or the association that people have with asylums, you know,
I mean,
these
the
kind of
treatments back in the day, lobotomies, for God's sake. I mean, what else to have, like scalpels cutting off your, you know, parts of your brain from your eyes? That, I mean, I definitely understand that, you know, that how scary that is. But this happened, you know.
It doesn't happen anymore.
Yeah.
You know, of course. That's what it was like in the olden days.
Right.
And it's true that there are some people that have gone through treatments, you know, in psychiatry with maybe medications and over medications, and this has kind of, you know, frightened a lot of people around this. But you know, today, in at least in our time, this is more carefully done. And you have more of a multidisciplinary approach.
In most places.
Exactly.
I mean, I can say that there are some psychiatrists that over-medicate, and you get catatonic clients just walking into your office, and you know, and you know that they weren't like that.
Yes,
so it's,
meaning that, for example, a person might be struggling with a lot of anxiety, symptoms and panic attacks, not feel good at all, and then perhaps be medicated and then become completely numb. You know, that is obviously not a correct way of doing things, but it's important to be to know that obviously the analogy that I like to use when knowing that I'm seeing a client, a patient who clearly isn't responding to the therapy, or perhaps their symptoms are too severe that they can't really benefit from the therapy, that it's so important to explain to them what is the role of a psychiatrist, and to explain to them how that is is important. And I often use the analogy of person who's diabetic. It's not their fault that they happen to be diabetic.
Right.
Their bodies, for some particular reason, isn't producing the right level of insulin.
Right.
And in this day and age, we can do something about it. And then these people can live, a healthy, efficient, effective lives.
Yeah.
Without the struggles. And so similarly to that, we have mood regulators in our brain, and that affects how we feel, it affects how we think, it affects how we behave, so many things. And sometimes there's a biological reason to our mental health condition.
Exactly, an organic reason.
An organic reason.
And I think it's very important also to let people know that, us as physicians, we're limited physicians. Doctors have the authorization to order a CAT scan or some other type of information that can go further into your brain and watch that activity and see if there is something else going on in there. But even so, there's just so much fear surrounding the psychiatrist.
Yes, and I think that's why these kind of conversations, these kind of talks is so important.
Yeah, to put it out in the open and
Yeah, I mean, of course, there's a lot of information out there that's being said, but there's so many ways of sharing information, and we need to repeat sharing this information.
Yeah.
Because still people are afraid.
Yeah.
Still, we're seeing even now, I mean, here in Indonesia, we're still seeing people who are, afraid, who don't want to make the step, who might be ashamed, and maybe who prefer to be, perhaps not even though their family member is in desperate need of this kind of intervention, perhaps out of fear of the community, how they will be looked upon, they might actually just keep their child indoors.
Yeah, or locked up.
Or even sadly locked up.
Caged up in many rural, just very remote places in the island. Unfortunately, there is, unfortunately been reports of people being caged up for life because they have a mental disorder. Sometimes it can be mental retardation or autism, but it's the lack of understanding that these are also humans, that they feel that they have needs, that they need sometimes some type of special care and special treatment, and that they can't just be caged up and put away for nothing to be disturbed to them, and they can't be treated as as animals. And
Yes.
I think that there is a very important, let's say, educational work to be done around more rural and underdeveloped areas to just explain to people what is actually going on in the brains and in the development of these other people that unfortunately have had some type of disorder.
Yes. What I find is that for people who are making this brave step, and a lot of the time is out of desperation because they've reached rock bottom, or they're in a crisis state. They kind of bring their child, or they actually reach out to therapy, and then once they made that step, and then what I find is when you kind of take the time to explain a little bit more of the process and you demystify it with how the process is.
Right.
What is a psychologist? What is a therapist?
Yeah.
What goes on in the session, and you kind of really create more of a tangible information, and you explain things in a structured manner. And then if you need, to see a psychiatrist, and this is what's going to happen, but this is not just a treatment. There's a holistic side to the treatment.
Right.
There's a psychologist who works perhaps more on the cognitive, behavioral, and emotional aspects, maybe, learning how to talk, learning how to connect the dots, how did I get to this place where I'm at, and to explain the symptoms of what's going on,
right.
And so that you can learn how to manage and perhaps learn how to overcome maybe difficult past experiences. So it's about helping people put words to what they're experiencing.
For sure.
And there's many modalities, art therapy being one, and so many others all around. And having, I'm a big believer in having a holistic approach to care.
For sure. And I think that I agree with you completely in that, because we are, it's just we're not compartmentalized. We are a whole being, and we're very complex And you know, sometimes people, you know, need dialectic behavioral therapy, other will need cognitive behavioral therapy, other will really want to go back and go into psychoanalysis. And you know, it really depends on the person, on the culture, on what they want. Funnily enough, in Argentina, for example, in Latin America, psychoanalysis is like the thing to do. You are the weird one if you don't have a psychoanalyst. And it's just very popular, and they are very Freudian in their psychotherapy, and everybody and their cat has their psychoanalyst. But you tell them about, you know, cognitive behavioral therapy or art therapy, they'll be like, what? What are you talking about? Like, no, like this is the only way to do it. So it's, I think culturally there's a lot of, a lot of, you know, difference in that.
And that's really interesting to know that actually in different countries, different cultures, mental health is perceived differently. People are beginning to respond differently to that. People are becoming more comfortable in some countries with saying, as you said at the beginning, that I have my therapist, and it's like, it's normal to have my therapist, and, and it's actually a good thing, you know. It's like, okay, I have, you know, my yoga teacher, I have my dentist, you know, I have, you know, it's the person I come and speak to, and I feel better afterwards, and I work on these issues. But it's interesting to see how different culture, different country has a different take on these different psychotherapeutic approaches, as you mentioned.
Yeah, and now here in Bali now you have, like, for example, men's circles, which is something that I had, you know, you always hear about women's circles and women, you know, getting together and talking and sharing their issues and their things, and but now you start to see a lot of men's circles popping up, and it's like how good that it can, you know, that we can really, you know, start talking about things more openly with others. Yes, of course.
Okay, well, I'm sure we can continue. You know, this is like an open discussion. I mean, there's a lot to say about these things. But I think it brought up a lot of nice subjects that probably deserve more of discussion, maybe on other, you know, on another talk, another time, another 6 p.m. So, okay, I hope this was interesting for you. If you have any questions, please just share the questions that you have. And if you have any questions you'd like to ask Natalia, who is our guest today, please just send the messages across. We will be tagging Natalia's social media as well.
Art Therapy Bali in Instagram, and the webpage is arttherapyandcreativity.com.
Great. So we'll be adding this information also in the caption below. Yes, I'm sure we'll have Natalia again on the 6 p.m. talk. All right. So I hope you are all well. Thanks again.
Thank you so much.
You know, Teco tea. Wonderful. Tea is always good. You know, just as a way to kind of. There's so many health benefits, and it's very soothing, and especially at the end of the day, or even in the morning to start your day. You know, it's just wonderful. So wherever you are, have a lovely rest of the day. Okay, bye for now.
Good evening.